So my name's Suzy Jeffries. I'm the executive director at North by Northeast Community Health Center, and we are a clinic that serves uninsured and Medicaid-covered adults. We focus on the African American community in Portland, and then also on our local neighborhoods here in North and Northeast Portland. And I guess when I sort of think about enrollment, what really comes to my mind is the big questions that, as a clinic serving uninsured, that we had to really ask ourselves when it became clear that the Affordable Care Act was going to move forward and healthcare transformation in Oregon was going to move forward. Since 2006, we've just seen uninsured adults and been really committed to being a place where folks who had no access otherwise to healthcare could come for access. And then realized the vast majority of our own patients were going to be eligible for enrollment in Cover Oregon, and the vast majority of those folks would be eligible for Oregon Health Plan. We started hearing from patients, this all sounds great, I'm really excited about being able to get on OHP after years of sort of this reservation list system where, I might get an application in the mail, but I may never get one, but I don't want to stop coming to North by Northeast. And if it means I have to stop coming to North by Northeast, I don't know if I'm going to sign up. And we knew we didn't want to encourage people not to sign up. A lot of our patients started getting the fast track letter last fall. A few of them brought it in and said, what is this? Do I have to sign up for this? If I sign up for this, can I still keep coming here? And by that point, we'd already decided that our commitment to our community needed to remain during healthcare transformation, after healthcare transformation, and made this pretty big decision to expand to include continuing to provide primary care services to our Medicaid patients, or to our newly enrolled Medicaid patients. We have a grant from Cover Oregon as a community partner to do enrollment. So we have kind of this unique perspective where we see people from the kind of beginning of the process to the end of the process in terms of getting enrollment or getting enrolled, and then establishing with a primary care provider, which is us, for new patients sometimes, but also for a lot of the folks we've been seeing for a really long time. So it was really important to us when we sort of thought about our enrollment efforts to not just think about sending someone out the door and being like, good luck with getting your OHP card in the mail and finding a primary care provider and finding a dental care provider. But we were very committed to making sure that wasn't the last, contact we had with someone, but that we actually would then follow up and make sure that they knew how to use their benefits. They actually knew what to expect in terms of when they should get information from the Oregon Health Authority, what's a CCO, what is a health plan, who am I going to get a card from, and then ultimately, how do I find a primary care provider? And we've been able to be that primary care provider for a lot of our own patients and for a lot of new folks too that we've met through the enrollment process. So our strategy was to reach out first and foremost to our own patients for enrollment. We identified about 400 sort of high priority patients of ours, so mostly folks who we were already seeing as a primary care home generally for hypertension, diabetes, depression, asthma, and reached out by phone and mail to those folks, really trying to get them enrolled. And then from there, are now reaching out every time people walk in the door for a visit through our walk-in clinic or a blood pressure check, or to come pick up medications or just find out what we're all about. We're always including a conversation about enrollment in those conversations. And then we're doing more broad sort of community-based outreach. So we had our first enrollment event last weekend, and we'll probably be doing another one, doing some advertising locally to sort of promote our availability to do enrollment. When I started working at North by Northeast, I didn't have any background in healthcare. And I think my initial assumption about the greatest value that North by Northeast brought to the community was just straightforward access. People don't have health insurance, and they don't necessarily have the financial means to pay out of pocket for care. So we eliminate those barriers. You don't have to have health insurance to come here, and it's free. And over the 7+ years that I've been at the clinic, it's become really clear to me that those are not the only barriers that many of our patients face in sort of making their way to good health. And so by the same, sort of logic, just getting enrolled in health insurance doesn't, it's a good first step and it's really important, but it doesn't mean good health. It doesn't necessarily equal good health. And there's so much work that clinics like ours and other health organizations and other safety net clinics do that's so meaningful around reaching people, I think, where they are with their health, providing culturally specific services. And that, I think, is, to me, that feels like the important work that we're doing and that we're sort of promoting in the community.